Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes once again. Our contact number is 76967 34256 for the best OET coaching. And please subscribe our channel if you have not. I'm doing the third question of the day. And again, thanks to people who have created this question paper. Most probably the Cambridge Box Hill or the original OET ones. Thank you for this sample paper. Again, my job is to teach you how to do it. So the phrase a thorn in medicine side, thorn, every rose has a thorn, means every rose, every blessing has a curse, means thorn is a negative word here. So first of all, you should try to understand the tone, that what is the tone of my question. In questions like these, when they are talking about some negative and positive word, so a thorn in the medicine side means something is negative. The phrase highlights the way that the placebo effect. So this is the second thing, placebo effect. Let's see what is the meaning of this word. So these questions, normally people call it lexical questions or whatever, or phrases question. But again, the question should be easy. Don't grade your question that these questions are difficult. Let's Kapchuk is a professor of medicine at Harvard. For last 15 years, he and fellow researchers have been studying the placebo effect. Something before 1990 was seen simply as a thorn in the medicine side. Means placebo effect used to be a thorn in the medicine side. To prove that a medicine is effective, pharmaceutical companies must show not only that their drug has desired result, but also the effects are significantly greater than of a placebo control group. What does this line mean? That to get approval of any medication, that this medication is effective. Suppose if I talk about paracetamol. So paracetamol, if by taking the paracetamol, fever subsides, then it can be due to psychological as well. So this medication has to be competed with the placebo medication. Placebo is a medication that does not contain any drug. That is not a medicine. Placebo is just a kind of a neutral drug. So they are saying that placebo was a kind of a thorn in the medicine side. That means placebo was a trouble for the scientists, for the researchers, because they had to show that their medicine is more effective than placebo. So thorn in medicine side means it was a negative thing when it comes to the researches. Okay? So, and again read, and he Kapchuk, for the last 15 years, he and his researchers have been studying placebo effect, something that before the 1990 was simply a thorn. So now if you will read the keyword, placebo effect used to be a negative thing in the medicine science, and that is said by the researchers. So let's go to this question. Highlights that way the placebo effect varies from one trial to another. There was nothing like that. It varies from one trial to another. Again, use elimination method. Varies means changes from one trial to another. There was nothing like that. They were comparing placebo with the original medication. Affects certain patients more than others. It was not saying it affects some patients more than others. Nothing was like that. Again, eliminate. Easily elimination. Increases when researchers begin to study it. Again. Complicates the process of testing new drugs. Yes, it complicates. It is a negative thing as well. Again, we were trying to find something negative. So complicates the process of testing new drugs because the new drugs have to compete with the placebo effect. So that's why it was a thorn. So if you simply say, if you would have understood thorn is a negative word, then anyhow complicate was the only word that was going with it. Certain patient, these words like certain are very important. Certain word, they were not talking about certain patient, that one patient has more effect, other patient has less effect. They were not saying that it changes from one trial to another. They were not saying that it increases when researchers, nothing like that. So these questions are easy elimination. Now you generally say, sir, these questions are difficult. No, it depends upon how easy you can eliminate other options. So in this, D is an obvious answer. I 100% am sure. I don't have to check even the answer. So please do not grade that these questions are always difficult. This is a wrong thinking. These questions can be easy. Don't grade your questions. Always see how easily others can be eliminated. Varies from one trial to no. Certain patient no. Researchers no. Complicates the process. Yes, this is an active thing. Definitely. So that is how you do questions like these. And please be positive about these questions. And these questions can also be easy. It depends upon the question. This is Dr. Bhupesh from Dr. BKM Institutes recording another reading question for you to tell you that reading or OET reading is very easy with this best method known as elimination method. Thank you.